As a young amateur actor, I always wanted to have a gig at the Grand Opera House, but I'm not sure this is the gig that I wanted. But anyway, thank you for inviting me. Okay. Grand. Thanks, Cameron. Basically, this is what I'm going to talk about. Why are we doing a review? What's the review all about? I'm going to talk a little bit about how you can get involved in it, what we've done so far, some early emerging issues, and I use the word early advisedly because there's some things coming out of what I've seen, and I'm fairly new to supporting people. Although I've worked in housing for 6 of the last 7 years, I've really only been involved in supporting people probably for about 6 or 7 months. But some of the things that have struck me, just seeing some of the evidence, and then talk about what's next. I suppose why a review is fairly easy, and the former accounting officers in the audience will understand this point very well. We've spent over £600 million on supporting people since 2003. We have never done a value for money review. So for me, that answers the question of why. I mean, it's really important, particularly in a time of a tight fiscal climate, budgets are squeezed. I think we need to understand across all of our programmes what works, what doesn't, what's effective for the taxpayer, what isn't, and make changes that are needed. There's clearly value in a robust evidence base to support future bids as well. I mean, I think I'll touch on this later, but the mood music we're getting out of London is that public sector expenditure squeezes haven't really hit in Northern Ireland. And Ed Balls has made it clear that if Labour win the next election, he's going to stick, at least for the first couple of years, to George Osborne's budget. So what that means going forward is we may not have any more money, and we may actually have less. So even to stand still, we have to make a very solid case, even for standing still, never mind growing. And that's just the reality. So in addition to supporting our future budget bids, what we want out of the review is an indication of where we can continuously improve. I joined the civil service in '96. There was a programme called the Continuous Improvement Programme. And that struck me as a young civil servant, that it's not just about getting better at one stage and point in time. We need to continuously improve and continuously look at our practice. I think that's really important. The terms of reference is in your pack, but there's a reference there to the website. In terms of the objectives, there are 4, and they're fairly simple. The first one is, and it is a big ask, over 11 years we're going to look back and look at what money has been spent on and the extent to which it has met needs, or identified needs. Secondly, we're going to say, in delivering against those needs, to what extent does the evidence say that SP is delivered in an efficient and an effective manner, and Phil has given a perspective there, and there will be others. Thirdly, is the operating environment right? So do we have the right legislation, the right legislative framework? Do we have the right policy environment? Do we have the right administrative structures to deliver supporting people in an efficient and effective way? And then finally, to make recommendations for improvements, changes going forward to improve efficiency and effectiveness. You'll see from the terms of reference that we're doing what I'm calling a modular review. We're using the expertise that we have internally, and because I manage right across policy, I have statisticians, I have economists at my disposal, I have policy staff. I'm bringing them together and using them to do different pieces of the review. Some of them know supporting people well, some of them don't, so they're bringing different perspectives. And I'm also bringing external expertise in conjunction with colleagues in the Housing Executive. We have already procured, and it's completed, a study on the value for money of floating support services, and that's available on the research section of the Housing Executive website. And also working with Brian and with Joe Fry in the Housing Executive, and we're about to issue a contract for a piece of work, which I'll talk about later, on accommodation-based services. So we're doing a mixture of things. We're doing desktop analysis, I have some site visits lined up, we're doing stakeholder engagement, and we're bringing external expertise in as well. We aim to have a draft report in early 2015 with a final report in March 2015. It's quite a tall order because, as Cameron said, it's a big piece of work, but that's what we're working towards. In terms of getting involved, I mean, we've had some initial and Brian will recognise this phrase because I've used it in a couple of meetings, some interesting and fruity engagement with colleagues, providers, with CRISP and with NIFA. And I mean, I think there was a very good exchange of views and quite a robust exchange of views, but I think that's really helpful. As part of the project, we'd always envisaged having a project advisory group, and essentially that's the forum through which provider input can be channeled. And we're currently talking to CRISP and to the Federation around how that advisory group will operate and when it will have its first meeting, and we're hoping to have that in September. We're also looking to do some workshops in the autumn to bring a broader range of providers together to get views, because I think, as Phil said, you can churn the numbers in any number of ways, and there are any numbers of different methodologies that you can use, but ultimately, to get that qualitative perspective, you need to talk to people. You need to talk to people who are receiving the service. You need to talk to people who are delivering the service. You need to talk to families. You need to get a broad perspective, and that's what we're very keen to do. I mentioned research. I suppose the floating support research has been done, and I know a number of providers were involved in that. There are 2, potentially 3 other pieces of research which, as providers, you'll have an opportunity to be involved in. The first is a study, a value for money study on accommodation-based services within SP. It's a companion piece, essentially, to the floating support. It's learnt from the methodology that we used in the floating support piece of work, and we're transposing that in. That contract is about to be awarded. I can't tell you to whom yet because they don't know, but it will be awarded very, very shortly, and work will start in the summer around that. Once we've had the project initiation meeting, we will publish the details of how that project is going to operate, and there will be opportunities to get involved. The second piece of work is there is a piece of work being led by Brian and Joe Fry in the Housing Executive in partnership with the Health and Social Care Board, which is around looking at resettlement and how the resettlement process, what some people call Bamford, worked, how it operated. There are service users engaged in that as well, and that is a study basically to look at how that element of supporting people and health policy operated, and whether it was effective and how effective, and to gauge a wide range of experiences. I think probably uniquely, I think I took the criticism as it was intended in a positive way this morning from Ricky, I think it was, around not having engaged service users. I think one of the things generally, and this isn't just a criticism of us, of my unit or of my department, but I think generally it is a weakness in evaluation across government that we don't or haven't always involved service users to the extent that we should. And Ailish, my colleague who's here, and I have been very keen to make sure that the service user voice is heard within the SP review. For some service user groups, that's actually quite difficult, as you know, and there are all kinds of ethics that we're having to go through, and that Brian is going through in terms of the resettlement work. There are all kinds of issues around that, but we're keen to make an attempt. It might not be perfect, but the principle of hearing the service user's voice is, for us, critical. Progress so far, and really what I'm kind of just going to outline some things. I'm treating this as as you probably see from the terms of reference, I'm a magpie in terms of how I want this to work. We're drawing in lots of pieces of work which aren't necessarily formally part of the review, but which inform what we're trying to do. And along with Brian and with others in the room, we had a number of really good discussions with trusts, with the board, with Federation, with housing associations, and the Housing Executive and ourselves and the Department of Health back in February around the blockages to delivering new supported housing. And there are a number of blockages, and we've identified some key issues. We have, since that meeting, sort of crystallised that product, if you like, into 3 pieces of work. And I'll tell you a little bit in a minute about those, but we're currently talking to Atlantic Philanthropies and another government department to co-fund that with us, and discussions at a relatively advanced stage, so we're fairly hopeful that within the next 2 months we will have confirmation of that going forward. And the 3 projects are essentially, firstly, to look at the future in terms of particularly the elderly client group and physical disability. I think what we collectively discussed was we're at a turning point. There's been a lot of focus in health and social care, particularly on the resettlement agenda, and that's very much driven activity. There's been dedicated budgets, and there's been a great focus on resettlement, and rightly so. But in the area of older people services, older people supported housing, and physical disability, there have been some, I think, opportunities missed, and there's some opportunities to be gained. So we think there's a piece of work that needs to be done, which is looking at future models. It's looking at future models in the geographic context of Northern Ireland. A model that is going to work in Belfast isn't necessarily going to work in Enniskillen or Limavady or Newtownards. So we think there's a piece of work there. We need to tease out the terms of reference. It will almost certainly include access to assisted technology, which we talked about earlier, as an attempted strategic response to that issue. It will also try and look at the current forms of housing for older people that we have, like sheltered housing, and I know I've had some really good discussions with Colette and Clanmill and some others around whether sheltered housing is being appropriately used and allocated into. So there are a range of issues. I think we need to have some kind of work around modelling that gives us an opportunity for a joint conversation across both the housing and the health families in terms of where we go. The second piece of work is to say, well, what has worked well to date, and what has encountered challenges and difficulties, and why has it? Angara is well mentioned, and Fiona mentioned it earlier. And there are some other schemes that haven't worked, and why haven't they worked? And what can we do to A, address the challenges in those schemes, but B, learn going forward in terms of, to make sure that those kinds of issues don't arise again. And the third piece of work, and the Health Committee I was recently at the Health Committee with Brian and with colleagues from Health, and they're very interested in how we sell, how we present, how we communicate about what supported housing is to families, to individuals, to professionals. And we think there's a piece of work there needed around really presenting the benefits of supported housing. And Cameron has put in a proposal for that work, and that's the basis of our discussions so far. I mentioned the research done by RSM McClure on floating support, and it's really worth a read. If you haven't read it, the executive summary is only 5 or 6 pages. It's a really good report, and basically what it says in floating support is more or less, on lots of services, Northern Ireland benchmarks very well with Great Britain. On some other services, it doesn't. That there are circumstances, and it details on where floating support has been highly effective. There are other areas where it hasn't. There need to be clear entry points for service users, and there are big patches of Northern Ireland where there are limited services, and that this presents challenges in terms of the number of providers we have and the fairly localised provision. And there's some challenges there about how those service gaps can be met and how providers can respond. And they're also to raise some of the, to kind of take it a little bit further, some of the points that were mentioned this morning. There's a lot of focus, this report said, on measuring inputs and a lot less on measuring outputs, and there are opportunities there. I've mentioned the research that was completed there. I've mentioned the research already that is going on, and from that, I suppose, I've identified some things that I'm starting to ask questions to my team, and as kind of early emerging issues. I mentioned earlier the outlook for government finances. I mean, that's the reality. We might not like it, but the reality is money is tight, and it will continue to be tight, and it may be tighter. So unless Mr. Farage suddenly pulls a strange election, or there's some, we're going to have one or other party or a coalition government in Westminster, and the main parties have committed to a particular course of action in terms of fiscal policy. So that's where we are. We have a large number of providers in Northern Ireland. I think there are 860 different providers. And to me, I'm just scratching my head as to why we have so many in such a small geographic place. Just purely from an oversight perspective, there's a lot of cost involved in trying to oversee 860 projects, and I'm not sure how Brian can do it with the limited resources he has at his disposal. He's doing a great job, but to oversee 860 projects is an enormous task, and there are challenges in there, and I just, it's a question mark, and I'm happy to be challenged on it, and I'm happy to have conversations, but to me, we have a lot of providers, and I don't quite understand why. Thank you, Alan. I owe you a fiver for your point this morning around procurement. I mean, we do have a lot of scrutiny, and procurement is one way to demonstrate that you're achieving value for money. It's not the only way, and I would be very, very, very keen to hear alternatives, sector-led alternatives. 860 providers, for me, there must be, if there's not opportunities for mergers, there must be opportunities for collaborative working. Back office services coming together, and I am really happy to hear alternatives to procurement, but there must be things, innovation that can be achieved to demonstrate value for money. In terms of floating support, the report from RSM McClure was basically challenging us, I think, to look at, can floating support be used more, and can it be used in different settings? I mean, that's something I think I'd be quite keen to talk to providers about as we engage with you in terms of the of supporting people. And there are issues, I think, raised by RSM McClure about integration of services, health and social care, floating support, particularly around things like addiction services. I think Ricky mentioned earlier. There must be opportunities. I know there's some joint working happening already, but there must be opportunities to do more of that. And I think capturing the opportunities of transforming your care, I think as Phil mentioned, there are, I mean, his study will show that there are savings to the health service from SP, so therefore there must be some opportunities in terms of us delivering some services on a community-based model as we're doing, and doing more of that going forward. So I think there's a little bit of a discussion that needs to come through around that. In terms of what's next, basically we're in the information and evidence gathering phase. We're getting financial information, we're distilling those reports, and we're starting to take stock of those and what they say to try and start to guide us in terms of how we engage with providers and service users. We will soon appoint the researchers with the housing executive in terms of our research on accommodation-based services. We're working through our bits of the review, and as I said earlier, in terms of those 3 projects that I talked about, to unblock or attempt to unblock some of the blockages in new supported housing, we're going to be working on business cases, gathering funding to make those happen. And we are going to engage fully with providers and with service users through the autumn. So we look forward to having an ongoing discussion with you. And just at the back there is the email account that we've got set up for the review, and we're very happy to hear views with the resources that we've got available. We're happy to have conversations. We obviously can't talk to every single provider individually, but we're happy to engage with you in the best way that we can.